Ever feel like healthcare is a puzzle, especially when you're traveling? It's like trying to explain your medical history in a completely new place. But what if your health records could just follow you anywhere you go in Africa? That's the idea behind this single digital health market blueprint. It's from the Smart Africa Alliance, and we're diving deep into it today. It's a plan to use digital technology to totally change healthcare access for over 1 billion people. We're talking about secure digital wallets for your health records, telehealth appointments across borders, even potential cost savings. It's a lot to unpack, so let's jump right in.
It is a pretty ambitious goal, making healthcare seamless across an entire continent. But the thing is, Africa's healthcare landscape is incredibly diverse, and this blueprint gets that. It's not about imposing a single system on everyone. It's about establishing the foundation for secure, interoperable systems that can actually talk to each other.
And they even use a story to show how this could work in real life. It's about a woman named Moraid Zoe, who needs specialized heart surgery. It's really interesting how they use her story to make it all more relatable.
Yeah, her journey through the system kind of highlights how this digital setup could work in practice.
Okay, so the blueprint has this framework with three main pillars. Let's break them down one by one. First up, we've got the foundational layers. What's the deal with these?
Well, it's all about getting the basics right. So think things like a reliable power supply, internet access that people can actually depend on, and making sure there are enough devices, like computers and smartphones available. Then there's the policy side of things. You need clear regulations for data privacy and security. Oh, and of course, you absolutely need a skilled workforce,
Yeah.
healthcare workers who can use these digital tools effectively. It's like building a house. You need a solid foundation before you even start thinking about all the fancy stuff.
Right, so it's all about setting the stage.
Okay.
Okay, makes sense. So then what about the second pillar, the operational pillars?
This is where things get a little more exciting. We're talking about using technology to deliver healthcare services. So think of mobile apps for booking appointments, platforms online where you can access your medical records, even things like telemedicine for those remote consultations.
So like instead of someone traveling for hours for a basic checkup, they could talk to a doctor from their village using their phone. That
Yeah.
seems like it would be huge for people in rural areas.
Absolutely. This pillar is all about bridging that gap between healthcare providers and patients, especially in communities that haven't always had the best access to care.
Okay, so we've got the foundation and then the tools to deliver services.
Hmm.
But what's the big picture here? What's the vision for this single digital health market?
Imagine this. You're traveling anywhere in Africa and suddenly need to see a doctor.
Yeah.
But instead of carrying a ton of papers with your medical history, it's all right there on your phone, securely stored in a digital wallet. You can share that information with any doctor or hospital, with your consent, of course.
That would be amazing. No more trying to remember all the tiny details from years ago or worrying about losing important paperwork. But how realistic is it to actually create that kind of system across so many different countries?
Well, that's where this third pillar comes in. It's called the vision. And it's not about making every country use the exact same system. It's about creating a framework where all those different systems can work together. You can think of it like a universal language for healthcare data, so information can flow freely and securely across any border.
This universal language idea sounds really interesting. But let's get into some specifics here. What kind of features would actually make this single digital health market work?
Well, one crucial piece would be a unique digital ID for every patient. So it doesn't matter if someone receives care in different countries, all their health records would be linked together.
So no matter where Waridzo goes,
Yeah.
all that information is connected to her ID.
Exactly. And with her consent, her doctor could see her complete medical history. That way, they have everything they need to provide the best possible care.
That makes things way more efficient. But wouldn't you need some massive database of doctors and hospitals all across the continent for this to work?
You're absolutely right. That's why the blueprint talks about key registries. So basically, these would be comprehensive lists of healthcare professionals, facilities, even medical terms, all standardized so everyone's speaking the same language.
So a doctor in Kenya could easily understand a patient's records from Senegal.
Precisely. It's called semantic interoperability. Basically, it just takes away any ambiguity. Clear communication is crucial for patient safety.
Got it. So we've got the data flowing smoothly. But what about privacy? How do we make sure that sensitive medical information stays protected?
That's definitely a huge concern, and the blueprint addresses that directly. It emphasizes strong systems for consent and data access, so individuals have control over their own information.
So, like, Waridzo could choose exactly which parts of her medical history to share with each doctor.
Exactly. She wouldn't have to hand over her entire file and hope for the best. She's in control.
This is starting to sound pretty futuristic,
It's definitely innovative.
but in a good way.
Yeah.
But how would this kind of system handle something more widespread, like a disease outbreak?
Actually, that's one of the strengths of this interconnected system. Imagine there's a sudden increase in measles cases in one part of Africa.
Like a public health emergency?
Exactly. Healthcare workers across the continent could be alerted almost immediately. They'd get real-time data on the outbreak.
So they know about symptoms, treatment recommendations, prevention measures, all in one place.
Right. Plus, they could use secure messaging platforms to talk to each other, share best practices and coordinate a response across different countries.
So it's like a network of experts working together to contain the outbreak.
And because they're all using the same standardized medical terminology, there's no confusion or misinterpretation.
Okay, I'm seeing the potential here. This blueprint really does paint a pretty impressive picture of the future of healthcare in Africa. This all sounds incredible in theory, but how do you actually make it happen? I mean, rolling out a system like this across an entire continent can't be easy.
You're right, it's definitely a complex undertaking. That's why the blueprint suggests a phased approach. It acknowledges that different countries are starting at different points, and they all have different resources available.
So it's not like you just flip a switch and everyone's suddenly connected.
Exactly. The blueprint actually outlines different readiness phases. That way, countries can implement these digital health solutions at a pace that makes sense for them.
So what would these phases look like?
So in the initial phase, the focus is on getting those foundational layers in place, making sure the basic infrastructure policies and training are all set up.
So laying the groundwork for a strong system.
Exactly. Then, once those foundations are solid, countries can start implementing some of the basic digital tools. Things like digital patient wallets, online directories of healthcare providers and facilities.
So even with limited resources, people could start seeing some of the benefits right away.
Absolutely. And then as countries move through those phases, they can start adding more complex things like teleconsultation services, electronic health records, and eventually that cross-border data exchange.
It's like building a house. You start with the foundation and then add on from there.
That's a great way to put it. And to help countries along the way, the blueprint actually provides a roadmap. It lists out the specific functionalities that can be implemented at each phase. So nations can prioritize their efforts and see how far they've come.
So it's not just a lofty vision.
It's a practical guide.
That's good to hear.
It shows how committed the Smart Africa Alliance is to making this happen.
We've definitely covered a lot of ground today. We've talked about the vision, the framework, the technology, and even the roadmap for implementation. But honestly, it feels like we've barely scratched the surface of what's possible with digital health in Africa.
Oh, absolutely. There's just so much potential. It's a really exciting time to be involved in this field.
This whole deep dive has really opened my eyes to the possibilities. But it's also made me realize how much more there is to learn.
That's the beauty of it. We're all learning when it comes to digital health.
This blueprint feels like a roadmap to a better future. One where healthcare is more accessible, more efficient, and more focused on the patient. It's a good reminder that technology can be such a powerful tool for positive change.
And it's important to remember that this isn't just about technology. It's about people, governments, healthcare providers, tech innovators, even individuals. We all have a role to play in shaping this future.
If anyone listening is as interested in this as we are, check out the Smart Africa Alliance website. They have a ton of information about their digital health initiatives and how you can get involved.
It's a fascinating field, and it's only going to become more important as time goes on. So stay curious, stay informed, and join us on this journey as we explore the future of digital health.
That's a wrap on our deep dive into digital health in Africa. Until next time, keep learning and keep exploring. Okay, this universal language idea sounds really interesting, but let's get into some specifics here. What kind of features would actually make this single digital health market work?
Well, one really crucial aspect would be a unique digital ID for every patient. So no matter where they receive care, all their health records would be linked together.
So like if Waridzo gets a checkup in Zimbabwe, but then needs surgery in South Africa, all that information would be connected to her ID.
Exactly. And with her consent, her doctor could easily access her complete medical history. That way they can be sure they have all the information they need. to give her the best possible care.
That sounds incredibly efficient. But wouldn't you need a massive database of doctors and hospitals across the entire continent for that to work?
Yeah, you're right, which is why the blueprint talks about these key registries. So basically, these would be lists of healthcare professionals, facilities, even medical terms, all standardized to make sure everyone's on the same page.
So a doctor in Kenya could easily understand a patient's records from Senegal without any issues.
That's the idea. This semantic interoperability removes any ambiguity. It ensures clear communication, which is obviously super important for patient safety.
Okay, I'm with you so far. But with all this data being shared digitally, what about privacy? How do we protect people's sensitive medical information?
That's a really important point, and the blueprint addresses it directly. It talks about having strong systems for consent and data access, so individuals would always have control over their own information.
So Waraidzo could decide exactly which parts of her medical history to share with each doctor.
Exactly. No more handing over your whole file and crossing your fingers.
She's in control. Okay, so let's say Waraidzo needs to see a specialist in another country, like for that heart surgery in South Africa. How would that work?
Well, her doctor in Zimbabwe could easily search this continental registry of specialists. They could find a qualified heart surgeon who specializes in the exact procedure she needs, all without leaving their office.
So they could find the right doctor without any hassle.
That's right. They could even set up a virtual consultation before Waraidzo even travels to South Africa.
Wait, so she could meet with the surgeon, ask questions, discuss the treatment plan, all from home.
Exactly. And since her medical records are securely stored in her digital wallet, they could be shared with the surgeon in South Africa, with Waraidzo's consent, of course.
This is starting to feel like science fiction, but in a good way. It sounds pretty amazing. But how would this system handle something more widespread? Like, let's say there's a disease outbreak.
Oh, this system could be really helpful in those situations, too. Imagine a sudden surge in measles cases in one part of Africa.
Like a public health emergency.
Yes, exactly. With this interconnected system, healthcare workers all across the continent could be notified immediately. They'd have access to real-time data on the outbreak.
So they'd know things like what the symptoms are, what treatments are recommended, and what preventative measures to take. All in one central place.
Right. Plus, they could use secure messaging to communicate with each other, share best practices, coordinate their responses across different countries.
So it's like having this network of experts working together.
To contain the outbreak as quickly as possible. And because everyone's using the same standardized terminology, there's no confusion or misinterpretation of important information.
Okay, I'm really seeing how powerful this could be. This blueprint paints a really impressive picture of what healthcare in Africa could look like.
Okay, so this all sounds great in theory, but how do you actually implement something this big? Rolling out a system like this across a whole continent, that can't be easy?
No, it's definitely a huge challenge. That's why the blueprint has this phased approach. It recognizes that different countries are starting from different places,
Yeah.
and they have different resources to work with.
So it's not like flipping a switch and everything's instantly connected.
Not quite. They actually outline different readiness phases in the blueprint. So each country can implement these digital health solutions at their own pace.
Okay, so walk me through these phases. Well, in the very beginning, the focus is on those foundational layers we talked about, making sure the infrastructure's there, the policies are in place, and that people have the training they need.
So it's like laying the groundwork for a really solid system.
Exactly. And once those foundations are strong, countries can start adding in those basic digital tools. Things like digital patient wallets, online directories for healthcare providers and facilities.
So even with limited resources, people could start benefiting from this right away.
That's the idea. And then as countries move through those phases, they can start adding more and more functionalities like teleconsultation services, electronic health records, and eventually that cross-border data exchange we talked about.
So they kind of build on what they've already got.
Exactly. It's like building a house. You start with a solid base, and then you add on from there. And to help guide countries through this whole process, the blueprint actually has this roadmap. It breaks down exactly which functionalities can be implemented at each stage, so each country can prioritize what's important to them and track their own progress.
So it's more than just a nice idea.
It's a practical plan.
That's great.
Yeah, it really shows how committed the Smart Africa Alliance is to making this a reality.
We've covered a lot of ground today, but it feels like we've just scratched the surface of what's possible.
I think that's true. Digital health in Africa has so much potential. It's a really exciting area to watch.
This deep dive has been eye-opening. but it's also made me realize how much more I need to learn.
That's the best part. We're all constantly learning when it comes to digital health.
This blueprint gives me a lot of hope for the future. One where healthcare is more accessible and more efficient for everyone. It shows how technology can be used to make a real difference in people's lives.
And it highlights how important collaboration is. We all have a role to play in shaping this future.
If anyone listening wants to learn more about this, definitely head over to the Smart Africa Alliance website. They've got tons of info about their digital health initiatives and how you can get involved.
It's a constantly evolving field, so definitely stay curious, stay informed, and join us as we keep exploring the future of digital health.
That's it for our deep dive on digital health in Africa. Until next time, keep learning and